All right, we're going to talk about the endocrine system, do a quick review of these things. So a quick difference between endocrine glands and exocrine glands. Um, so some of you may remember this from anatomy. This is how, I don't remember if the professor or the TAs taught it this way, but they said when you see your X, you duct. So exocrine glands have ducts, and the ducts cause the chemicals to go to the outer surface of the body. Um, so this also includes the GI system, and you may be thinking, but the GI system is inside the body. But technically, at least is what I was told, because there's holes in both ends, it's considered outside of the body. Because you don't have to puncture anything to get to it. You can just go all the way through. So it's considered outside the body. So there are exocrine glands that release chemicals into the GI system. And then anything that releases hormones into the blood or into the body system, those are endocrine glands. Okay, so let's talk about the hypothalamus and the pituitary gland. So the hypothalamus does a lot of stuff. And one of the things that it does is it controls the pituitary gland. So it releases some hormones that cause the pituitary gland to release hormones, and it helps pituitary to make these hormones, and pretty much it helps the pituitary gland. And so here are two acronyms that can help you to know which um, gland of the, or either the anterior or the posterior releases which hormones. And also for a lot of these, I just looked up easy ways to remember these in ChatGPT, and it gives you a bunch of options. So if you don't want to create something on your own, I highly recommend doing that to you. I think it's really helpful. So flat pig, I think this is the one that she teaches. So this is um, follicle stimulating hormone, luteinizing hormone, adrenocorticotropic hormone, thyroid hormone, prolactin, and growth hormone. And these are all released by the anterior pituitary gland. And then PP pumps, this is the posterior pituitary, a little alliteration for you. And the P and the two P's stand for pressure and pregnancy. So pressure is antidiuretic hormone. So if you're not diuresing as much, retaining more water, the pressure inside of your blood vessels will increase. So that's antidiuretic pressure pump. The other P is pregnancy, because um, when a woman is giving birth, oxytocin is the hormone here that is released in large amounts to help the contraction of the uterus and cause the baby to be born. And also a little fun fact, when a woman is giving birth, um, oxytocin also affects the breast to release lots of breast milk. I don't think there's a reason for that, simply because of all of the oxytocin that's being released to help the contractions, that also has that effect. So oxytocin and ADH are posterior pituitary gland, and all of the others are anterior. Okay, so thyroid, parathyroid, and adrenal. So your thyroid gland controls your metabolism. So it releases thyroid hormone into the blood, and pretty much more thyroid hormone, your body cells are going to use more energy. And so we'll talk about that a little bit more later. It also releases calcitonin. So calcitonin puts calcium from your blood in, so calcitonin to your bones. So it'll decrease the calcium in your blood because it's putting them in the bones. Parathyroid does the opposite. So parathyroid hormone will bring calcium out of the bones and into the blood. So it'll increase the calcium in your blood. And then adrenal glands control stress response and blood pressure, now aldosterone. So pharmacology, Ross system, right? Renin, angiotensin, um, aldosterone system, right? So that's going to increase your blood pressure. And then stress response is because of cortisol. So when cortisol is released, one of the things that it does is it increases your blood sugar, creating more of a energy source for your body's cells, because you might need that quick, fast energy if you're running from a bear or something. So that's your stress response increasing your glucose, and that comes from your adrenal glands, cortisol. Okay, so I'm going to talk about regulation and down regulation. So your body is really good at maintaining homeostasis. So if you have a bunch of hormone that's being released, then the amount of receptors on your cells will go down, because it doesn't need all of the receptors. And then if you don't have very much hormone being released, then your amount of receptors will go up. So upregulation. So that's just something that your body does to try and maintain homeostasis. And then there are four different kinds of releases of hormones. So we have steady state. So think of your thyroid. It's constantly releasing a little bit, or at least it should, of thyroid hormones so that you're able to use the energy that your body has. And then intermittent would be something like epinephrine. So bear comes to attack you, epinephrine spikes your blood pressure, and that would be an intermittent response. So it's not a constant thing, it's in response to some stimuli. Cyclic estrogen, this is right, the woman's cycle. I'm not gonna get into that, but I hope that makes sense. And then diurnal, so this is like kind of like a change in the day. ACTH is going to release more cortisol in the morning than at night. Not 100% sure why, but it does that. Okay, hyperthyroidism. So can be caused by a ton of things, but all of them result in excess thyroid hormone. And it manifests as a goiter. So it's going to be like an increased size of your thyroid gland, and exophthalmos, which is the bulging of the eyes, and this is due to like inflammation of the like fat and muscle behind your eyes, which cause your eyes to pop. And I think it also causes higher intraocular pressure. Um, so hypermetabolism, I just think of it as like someone who is like working out and they cannot stop working out. So weight loss, anxiety, heat intolerance, as in like you're hot, you feel so hot all the time because your body's just using so much energy. So this is hyperthyroidism. And then a thyroid storm is an extreme version of this, and it can result from an infection of your thyroid gland, or palpation. So if somebody's like, hey, check out my thyroid, it's massive, come feel it, don't do that because you might cause a thyroid storm. And so Graves' disease is a condition which causes these conditions in hyperthyroidism. So think of G for gaining thyroid hormone, Graves. Okay, and then these are the four P's. Um, uh, pro I won't read them, but these are the drugs that you'll want to know that can help with a thyroid storm. And so some treatment for hyperthyroidism could be radioactive iodine, meth methimazole. I think this is another one that can help with this, um, or taking out the thyroid gland completely and giving somebody thyroid hormone instead. So levothyroxine. Okay, so this is hyperthyroidism. Hypothyroidism is going to be the opposite. So Hashimoto's is a autoimmune disease, and pretty much attacks your thyroid gland, and you're not able to create as much thyroid hormone. Low iodine. Iodine is necessary for us to create thyroid hormone. So if you have low iodine, then you're going to have hypothyroidism. And pregnancy. So there's postpartum thyroiditis. It's just an effect that happens after pregnancy. So some additional things with this. Um, in Hashimoto's and pregnancy, it's it's something that's attacking your thyroid gland. And so because initially your thyroid gland is being destroyed, and it has reserves of thyroid hormone in the gland as it's being destroyed, you might see hyperthyroidism, which once it's finished being destroyed and that's done being released, it'll drop again and you'll have the hypothyroidism. And you're also going to see a goiter with this because TSH, which is being released by the anterior pituitary, um, and I hope I said that correctly on the previous slide, but thyroid stimulating hormone is released by the anterior pituitary gland. Anyways, so that is going to be hitting your thyroid because it's saying there's no thyroid hormone, and this feedback system is saying release more thyroid hormone. So your anterior pituitary keeps on sending the thyroid stimulating hormone, but nothing's happening. And so because of that stimulation that's not working from the thyroid stimulating hormone, your thyroid gland will also grow. So it's going to result in goiter as well. Um, Also causes hypothyroidism can cause heavy menstrual bleeding. Um, that could be important. Don't know, haven't seen the test, but it could be important. Um, so symptoms are pretty much the opposite of hyperthyroidism. And then here is someone, a young woman with cretinism. And so this is when you have low exposure to thyroid hormone in the womb, and it can cause mental deficits and short stature and things like that. And then just an additional note, myxedema is an extremely rare condition of hypothyroidism, which is kind of the like opposite equivalent of a thyroid storm. And pretty much your body's just giving out. Like your heart chambers get super like floppy and it's just not good. So if somebody has hypothyroidism, different ways to treat it, but you're just gonna give them a thyroid hormone to help with it. Okay, so now we're talking about adrenal gland. So Addison's versus Cushing's disease. So think of this as Addison's is absence of cortisol, Cushing's is C for cortisol. So Cushing's cortisol. So you have excess cortisol. Um, so if you have Addison's and you don't have enough cortisol, remember cortisol is released in response to stress. And so you're gonna have a poor response to stress if you have Addison's because you don't have that cortisol. Um, and also you're gonna have a low serum potassium, sorry, low serum potassium, low serum sodium, high serum potassium. And the way I think about this is pretty much if your kidneys are working as they should, then you are releasing a lot of potassium and retaining a lot of sodium. And so, for example, with lots of diuretics, it just increases this effect. And that's why they talk about like spironolactone and potassium sparing diuretics so that you're not losing all of that potassium. And so here, if your kidneys are not working well because you have Addison's disease and it's affecting your adrenal gland and the aldosterone and all of that, you're going to have a high serum potassium, low serum sodium because your kidneys are not working as they should. And I feel like this is the subject of every class, but if you have potassium abnormalities, that's going to affect your heart rhythm. So super important to always know that. We talk about it all the time. Um, and so these are some effects from Addison's that you can see here with this woman. And then Cushing's is too much cortisol. Usually this is from a drug. So if somebody's receiving like corticosteroid, and this is where you have the moon face and the buffalo hump and all of those things and the super large abdomen. And someone in my class, I think it was like a week ago, we're talking about this and they said, well, how do you know the difference between Cushing syndrome and somebody who's just obese? And they said it can be hard to tell, but if somebody has really, as you can see here, he has really skinny legs and a super large abdomen. So there's not, it doesn't look like a proper ratio. If somebody were obese, they'd just probably be obese everywhere for the most part. And so this is something that could be a telltale sign of Cushing's syndrome. So that's too much cortisol. So treatment would just be to stop giving them the corticosteroid if that's what they're receiving, or if they have a tumor on their adrenal gland that is causing the Cushing syndrome, to remove that tumor. Okay, so here we have diabetes mellitus blood tests. So we have fasting plasma glucose, random plasma glucose test, and oral glucose tolerance test. So I'm going to talk about this a little bit about the reasoning behind these numbers, and that way I hope it's not just memorizing random numbers because most likely you're not going to remember that long term. So fasting plasma glucose is you're not eating for a long time. I think it's 8 hours before the test is taken. And so if you're not eating, you're going to have a low blood sugar. So the bar for which you'd have to be diagnosed with diabetes is going to be lower because your blood sugar is going to be naturally lower, right? And so that's fasting plasma glucose. Um, Oral glucose tolerance test also requires fasting. So it's like your blood sugar is low, and then they give you some glucose, which would spike it high, and then in the end it kind of evens out to about the middle. So it'd be about the same as a random plasma glucose test, which is random. So because you're fasting and the glucose, it's going to be the same bar as if it were random. And then an HA1C measures the amount of glucose on your blood cells for the last 3 months. And remember, the reason for this is because your blood cells live for 3 months, right? 120 days. So normal is going to be less than 5.7. And then if you have diabetes, it'll be greater than or equal to 6.5% for HA1C. I think it's H1A1C, but yeah. Okay, type 1 diabetes mellitus. So this is an autoimmune condition which attacks the beta cells of your pancreas, which are what produce the insulin. So if you don't have insulin, you can have an increase in glucose. So these folks are completely dependent on insulin. If you're type 2 diabetes mellitus, you probably have some other kind of drugs, but these people, they really just need insulin. Maybe some other drugs would help, but insulin is the main thing that they're dependent on. And they also have chronically high glucagon. So to make matters worse, their glucagon is producing a bunch more sugar. So not only is the lack of insulin not able to bring the sugar out of the blood into the cells, but they have even more sugar because it's kind of like a feedback system, right? So when the glucagon sees the insulin in the blood, it's like, okay, there's sugar there because there's insulin there, so I don't need to release more sugar. But when it doesn't see the insulin, it's like, oh, there's no sugar, so we must need more sugar. And so it just makes the problem that much worse. And then high risk for ketoacidosis in these folks. I think we talked about that a little bit later. And then just a side note with latent autoimmune diabetes in adults, it's pretty much just a combination of type 1 diabetes and type 2 diabetes. So that's why they call it type 1.5. And because these people have partially an autoimmune factor, so they have antibodies to beta cells, but also their lifestyle and low birth weight and things like that, that are more that aren't genetic necessarily, um, affect their diabetes. So that's latent autoimmune diabetes 1.5. Okay. Chronic complications of diabetes. So three of these are neuropathy, vascular problems, and infections. So neuropathy, if you remember, is that numbness and tingling and muscle weakness that comes. And one of the reasons for this is because the blood sugar is damaging the blood vessels which supply energy to your neurons. And so if those blood vessels are damaged, then the neurons will also be damaged. And that is one of the reasons for this neuropathy. And then it's going to cause vascular problems. Pretty much think about it like metal rusting. Oxygen is to like the metal or iron as sugar is to the blood vessel. So it's essentially having this chemical reaction with the endothelium, and it's going to create problems and that kind of rust, but inside your inside your blood vessels, it'll be like plaque and things like that. And then infections, because bacteria need sugar to survive and reproduce. And so bacteria love high blood sugar. Okay. Um, all right, so diabetic ketoacidosis. So this is when your body is not able to use the sugar in your blood because there's no insulin, because the beta cells in the pancreas were damaged. And this is mainly happening with type 1 diabetes. So loss of fluid because you have glucose going out in your urine, and that glucose through oncotic pressure, the pulling pressure is pulling the um, water or fluid with it. Also causes metabolic acidosis, because think about it, your cells are not having energy from glucose. So two reasons for this acidosis is your protein and your fat is being broken down, and this is creating ketones, which is an acidic substance, and as well as creating lactic acid, because right when you work out a bunch, your body is changing its method for creating energy because it's not receiving the oxygen, so it's creating that acid. So it's kind of the same effect, but they're not working out right. It's just simply because they can't use the energy. So all of that is going to create metabolic acidosis. And what you're going to give these people is fluid, insulin, and potassium. So this is important because as these cells are being destroyed, they're releasing potassium into the blood. So it's creating hyperkalemia. But when you give somebody insulin, not only does it bring potassium into the cell or sugar into the cells, it brings potassium into the cells too. And so when you give insulin, you don't want that hyperkalemia to become hypokalemia. So you give insulin and potassium to anticipate the potassium being brought into the cells by the insulin. I hope that makes sense. And then here we have some signs and symptoms. And then just a side note, rapid deep breathing. I think this is the next lecture, but that is because your body is trying to blow off CO2, which is an acidic substance. And so Kussmaul's breathing, right? Rapid and deep like that. And you're breathing off the CO2 because your body's like, I have too much acid. I need to compensate and blow off some of this acid. So my pH can go back to normal. Okay, hyperosmolar hyperglycemic non-ketotic coma. Really rare. This happens more in type 2 diabetes. And pretty much it causes neurological deficits, which diabetic ketoacidosis doesn't cause as much, and there's no acidosis with this. And I think the blood sugars can reach even higher levels with HHS than DKA. So main differences between the two of those. So if somebody is hypoglycemic, you want to remember the 15-15 rule. I don't know if you've gone over this in fundamentals yet, but you give 15 grams, 15 grams of fast acting carbohydrate, and then you check their blood sugar again in 15 minutes. And then as you're thinking about what kind of fast acting carbohydrate you want to give them, you don't want to give orange juice if somebody has kidney disease, because remember the potassium, right? If they're not getting rid of the potassium from their kidneys, and they give them more potassium, hyperkalemia, heart problems. Okay, hope this was helpful.